We'll continue with our discussion about healthy living in mini lecture 2B. This is the food label, specifically the nutrition facts, which has a lot of great information when you want to make better food choices. We'll be looking at this more in class. It's important to take note of the serving size that is used for the nutrition facts panel. If you eat more than that serving size, then you have to do some math for the other numbers that are listed. Organic foods are preferred by a lot of consumers because of the lower residues of chemicals on the foods. There is a label that indicates whether the food was grown or raised with organic techniques, and that's a great way to spot these foods. Organic foods tend to be more expensive than traditionally grown foods. True or false? The answer is true. They are more expensive. Many consumers choose them because they want to limit their exposure to pesticides and other residues. And they may be interested in the environmental impact of that growing technique. As far as being more nutrient dense, there's a slight advantage, but the concerns are generally about fewer chemicals. In terms of healthy eating habits, use common sense, eat moderate amounts, go for flavor, not quantity. Try to choose nutrient-dense foods, avoid the substances we know are harmful, salt, sugar, and fat, but specifically unhealthy fats. We'll be talking about healthy fats. Eat enough fiber. Plan ahead. Planning is very important. Eat slowly, slow down. Americans eat far too quickly. Stay away from fast food and junk food. Drink plenty of water. And again, planning. Planning really helps you stay on track with your diet. Now we're going to talk about weight. In this country, weight's become a big issue. Most Americans are overweight or obese, and that can contribute to serious diseases, non-communicable diseases. The body mass index is often used to indicate health risk. It's not perfect. We use it in healthcare quite a bit, but it is not perfect as far as a one indicator to use. People with heavy skeletons or lots of muscle, this does inflate BMI. We know that as people become heavier, however, their risk for a number of diseases does increase, and that's our concern, the health risks. So we want people to maintain or manage their weight to stay healthy. In America, we live in an obesogenic environment. We eat lots of food. We're surrounded by inexpensive, high-calorie food. We don't move as much as we used to, so we're not burning as many calories. And that includes not only in our chores and our work, but also in our recreational time. And this is adults as well as children. To lose weight, you need to trim down the number of calories that you're eating. That's very important, and increase your physical activity. It's helpful to increase muscle mass as you become more physically active because muscle burns more calories. And it's also very important to understand the triggers for eating so that you can manage them or handle them differently. We certainly want to be aware of eating disorders. These are psychological entities. As far as treatment is led by a psychology professional. So these are very serious disorders, but treatment rates as far as success are quite good when people do seek out treatment. Now let's talk a little bit more about physical activity. Physical activity can burn calories, but more important than that are the health benefits that it brings. We feel better when we're physically active. It can relieve stress, help us sleep better. We feel more energetic, and it can help us manage some conditions. If we have arthritis, it tends to ease the pain of arthritis and things like lower back problems, and it also can decrease the risk of some disorders and diseases. So for adults, you should Engage in moderate activity, at least 30 minutes 5 times per week. And for children and teens, 60 minutes per day. You can include shorter bursts of activities or longer periods. And aerobic exercise is important for cardiovascular health. But it's also important that you engage in muscle strengthening exercise as well. Sleep is vital to good health, to functioning, to memory and using your brain. So it's very important that you get 6 to 9 hours on most nights as far as sleep. If you're not getting enough sleep, there are strategies for you to increase your sleep, and you see them here. A lot of it involves what you should stop doing and when you should stop doing it. So you see stop drinking caffeine 6 hours before bed, alcohol 3 hours, turn off your electronics an hour before bed. Engaging in enough physical activity during the day is also important to being ready for bed at night. And a bedtime routine is very helpful. So as young adults and older, it's very important that you get regular checkups and periodic screenings in order to stay healthy. As a healthcare professional, this will be required for your job as well. And when we talk about stress and healthcare, this is something that applies in a big way because healthcare professionals are under a lot of stress. We know that stress, whether real or imagined, has the same effects on our body, and these are physical changes, and it also can affect the brain as well. So the effects of long-standing or consistent stress can be negative upon the body. Things like weakening the immune system, contributing to diseases, and more. What's important is managing stress. Most of us can't cut out all of our stress, but we need to identify it. Is it external and out of our immediate control, or internal, something that is a bit more under our control? In healthcare, there are loads of stressors in the environment, and we can't react to it in a way that could impact our patients negatively. So we have to remain calm, we have to stay focused, we have to continue to complete tasks accurately. It's very important that we are able to manage stress in the workplace. So for students and for healthcare workers, what becomes important is identifying your stressors and then learning how to manage them. So some students learn to meditate, others find another activity that tends to relax them and enable them to release their stress. We'll practice some breathing exercises in class. Other health risks, of course, smoking is a big one. If you are trying to quit smoking, smokefreephilly.org is very helpful. Visit the website. Certainly in healthcare and beyond, there's a growing problem with substance abuse. In healthcare, there's easy access to these medications. But what is very important to remember is that engaging in abuse of substances for a healthcare worker can end their career. So the consequences can be loss of job and career, and of course all the negative impact to your health. Occupational hazards are many. Healthcare workers lift, healthcare workers run, healthcare workers handle needles. So we have to, again, stay focused and aware and use proper techniques in the healthcare setting. And just to mention, Philadelphia has very high rates of sexually transmitted diseases in their teen population, 3 to 5 times more than teens in other parts of the country. So it's very important to practice safe sex and also to send that message to your patients as well. Be open with your partner And certainly, if you need more information, takecontrolphilly.org is a helpful website. Lastly, we're going to talk a little bit about burnout. Burnout is not uncommon in healthcare, nor is it uncommon in students with regards to academics. When you work yourself really hard without taking care of yourself, you can become exhausted, and this can impact your work, your feelings about work, and can increase errors. In healthcare, there are many reasons why healthcare workers become burned out. It's part of the job to have long hours and difficult work conditions. But we want to make sure that we take care of ourselves as students and as healthcare professionals so that we can help others. Remember, you're a role model for your patients. Start now in learning how to be a role model for healthy living, because you'll be educating patients as well. That ends mini lecture 2B. Be sure to complete the response.